Good morning. I'd like to thank the ASH leadership for selecting our abstract for this press discussion. It's a pleasure to be up here with Iffy and my other colleagues. On behalf of the multidisciplinary, multi-institutional group, I'm going to present the results of our haploidentical transplant protocol and focus predominantly on quality of life and neurocognitive changes besides transplant outcome. So as a brief background, patients with sickle cell disease have a high risk of developing central nervous system complications. As you can see here in this cartoon, patients develop cognitive defects. Some patients have what we call a silent infarct, which means that they had a mini stroke but didn't realize they had it until it was picked up on a brain imaging. They may have overt strokes, or they may have intracranial hemorrhage and other complications, and some of these actually lead to death. More importantly, work that was performed looking at IQ as an endpoint. You can see here that in patients who have had silent strokes or overt strokes have a significantly lower IQ than normal sibling controls who don't have sickle cell disease. And even patients who have sickle cell disease but have not had any central nervous events have a significant decrease in their IQ. It's a little bit complicated slide, but this is looking at recent publication on the left here of neural processing speed, and this is in comparison to normal patients versus those that have either had an overt or non-overt stroke. So significant decrease in neural processing speed. And on this side is looking at the quality of life. And you can see here that this being close to 100% quality of life, patients at various ages have a significant decrease of quality of life, averaging about 40 to 60% of their normal controls. So very briefly, a complicated protocol. We developed a consortium of several centers and several core centers that embarked on this myeloimmunoablative conditioning, which consisted of giving immunosuppressive therapy for about 5 weeks, consisting of hydroxyurea and azathioprine, and then a more classical conditioning consisting of busulfan, cyclophosphamide, thiotepa, rabbit, antithymocyte globulin, and a 1 dose of total lymphoid irradiation. In this context, as if he mentioned, we used patients who did not have a sibling that was a full HLA match or full tissue donor. We chose parents, and we processed the parents' peripheral blood stem cells using a device called a Clinimax where we could select out and enrich cells that expressed a marker that was highly prevalent in early bone marrow cells. But then what was unique about this protocol is we added back a fixed amount of immune cells to promote engraftment and to promote immune recovery quickly, but not enough to cause a complication called graft versus host disease. For the purposes of today's discussion, we did a full battery of neurocognitive testing at baseline, at 1 year and 2 years, and we did a full battery of health-related quality of life testing, looking at emotional, physical, and a number of other parameters, and we tested both the patients and their age specific, as we tested one parental involved in the family, so we had a parent as well as a child's responses. So while the details will be given later today at 1:15 in room 24B, this is looking at the overall outcome, event-free survival and overall survival, reaching a 1 year overall survival of 90%. And to focus on the long-term follow-up, this is looking at intellectual functioning, processing speed, and memory. And you can see here for the processing speed, there was a significant enhancement in the processing at 2 years compared to what it was at baseline. From a health-related quality of life, you can see here, as expected, after 45 days or 100 days after the transplant, there's a significant reduction in the quality of life based on the transplant morbidities that one experiences with transplant. But by the end of 2 years, their quality of life, both emotional and physical findings, are almost approaching 100%, and they're significantly better from the decrease that they started with. And in summary, these are a number of the patients that are survivors of the transplant protocol, and basically we have now a 3-year follow-up of this study, and there are no patients that have any signs of sickle cell disease, sickle symptoms, and they're all off immunosuppressive therapy, and they're actually all off all drugs. And for more detail about this follow-up, I encourage you to come to the 115 presentation. Thank you.